Hi, my name is Brooks-Sullivan, and this is my intramuscular injection demonstration. So we'll start by reviewing the scenario. Today is February 7th, 2021, and the time is 20:30. And then I'll perform my first check by comparing the physician's order to the MAR. So Jake Nursing, Finn 312, 312, 654, 654, 987, 987, date of birth January 1st, 1960, January 1st, 1960, Dr. Spills Lab, and according to both of these documents, the patient has no known allergies, but we will confirm that with the patient at the bedside. So we'll start with the first medication here, metoclopramide, 5 milligrams, subcut, daily, and it's supposed to be given once a day at 0800, but the time is now 20:30, and I can see here that it's already been signed for on February 7th, 2021, so I won't be administering this medication. Diamond hydrogenate, 150 milligrams, IM, daily. It's supposed to be given once a day at 2100, the time is now 20:30, and it hasn't been signed for yet today on February 7th, 2021, so I'm okay to go ahead and give it. And I'm just noting that the physician has signed the order here, and both of these documents are double signed by the transcribers. Okay, so once I've done that, I can put the physician's order away, and I'm going to retrieve my medication from the supply. So I'm looking for diamond hydrogenate. I have diamond hydrogenate here. I'm going to be giving 150 milligrams, and this is a 50 milligram per milliliter vial, so I'll be giving 3 milliliters. And then I'm just checking to make sure this says intramuscular, which it does, and I'm giving an intramuscular injection. And then I'm going to, I would have already washed my hands at this point, and I'm just taking a look to see if the medication is expired, and it is not. Okay, so once I've done that, I'm going to review the reason for giving the medication, and that's due to our patient's nausea and vomiting secondary to chemotherapy. And then I've also reviewed any contraindications to giving the medication, and I'm okay to give it. And then I'll also take a look at the parenteral drug monograph. So I'm looking for diamond hydrogenate, and I have diamond hydrogenate here, and it's an antiemetic, which is what we want, and it says it may be administered by a student nurse, so I'm okay to give it. The maximum single dose is 100 milligrams. I'm administering 150 milligrams. But I've already phoned the physician and the pharmacy, and they've given me the go-ahead. The maximum daily dose is 600 milligrams. I'm well within that range. It says I can give it intramuscularly, and I'll be administering it undiluted. And the maximum concentration is 50 milligrams per milliliter. This is a 50 milligram per milliliter vial, so I'm okay. And then I'm also noting any potential hazards, which I'll let the patient know about as well. Okay, so once I've done that, I'm going to gather my supplies. So I need a 3 milliliter syringe, I need a blunt fill needle, and I need my injection needle. I've chosen a 23 gauge 1-inch needle for this injection, which is appropriate for an intramuscular injection. Okay, once I've done that, I'm going to open my vial, and I'm going to clean it with an alcohol swab for 30 seconds in a circular motion. Okay, and it's been 30 seconds, and then I'm going to let that dry while I open my supplies. So I'll wing back the packaging of my syringe here, and then maintaining sterility, I'll do the same thing with my blunt fill, and then I will connect the two. And now that my medication vial is dry, I'm going to inject air. So since I will be giving a 3 milliliter injection, I'm going to inject 3 milliliters of air. Okay. Injecting my air, and then I'm going to drop my medication. Okay. And then I'm going to recap using the scoop method. I'm just going to knock out any more bubbles. Okay, and then I'm going to pull back just to make sure that all my medication is within the barrel of the syringe. And then I'm going to take off my blunt fill, I'll put it into the sharps container, and I'll attach my injection needle. Okay. And then I'm going to calibrate to my desired dose, which is 3 milliliters. And I would be doing this over the med waste bin. Okay. So I have 3 milliliters there. Okay. And then once I do that, I'm just going to label my syringe. So this is for Jake nursing, and the drug is diamond hydrogenate. And the dose is 150 milligrams. And the concentration is 50 milligrams per milliliter. So I need 3 milliliters. And the date is February 7th, 2021, and the time is 20:30. And I'll sign it and put my designation as well. Show you my label. Okay, and then I'm going to attach this to my syringe, and I will perform my second check. Okay, so Jake nursing, diamond hydrogenate, 150 milligrams, or sorry, Jake nursing, diamond hydrogenate, 150 milligrams, the concentration is 50 milligrams per milliliter, and I can see that on my label here as well. So I need 3 milliliters, and I have 3 milliliters. Okay, and it's supposed to be given intramuscularly. This vial says intramuscular, and this is an intramuscular injection needle. It's supposed to be given daily, once a day at 2100. The time is now 20:30, and has not been signed for yet today on February 7th, 2021, so I'm okay to go ahead and give it. Okay, and after I do that, I'm going to put my medication back into the supply, and I'll gather my things so we can head to the patient's room. So I'm going to need an alcohol swab, I'm going to need a pair of gloves, a cotton ball, and the MAR, my drug cards, and my medication. Okay, so we can head over there. Knock, knock, knock. As I'm entering the patient's room, I'm doing my entrance safety check. Just checking to make sure the patient isn't in any distress, the call bell is within reach, and the bed is in the lowest position. Hi, my name is Brooks-Sullivan. I'll be your student nurse for today. Can I just get you to tell me your name and your date of birth? Okay, that's great. I'll just verify that with your wristband. So Jake nursing, date of birth January 1st, 1960. Date of birth January 1st, 1960. That's perfect. We have the right patient. And Jake, can I just ask you if you have any allergies? No, okay, that's what we have here as well. So that's perfect. And once I do that, I'm just going to perform my second check, or my third check now. So Jake nursing, okay. So diamond hydrogenate, 150 milligrams. The concentration is 50 milligrams per milliliter, so I need 3 milliliters. And I have 3 milliliters there. Okay. It's intramuscular, and this is an intramuscular injection needle. It's supposed to be given once a day at 2100, and the time is now 20:30, and has not been signed for yet today at on February 7th, 2021, so I'm okay to go ahead and give it. Okay, so once I do that, I'm just going to explain the procedure to the patient. So Jake, I'll just let you know that today we'll be giving you an intramuscular injection, and we're administering your diamond hydrogenate, which has been prescribed to you for your nausea and vomiting secondary to chemotherapy. I will just let you know that you may experience some side effects, which could include drowsiness, dizziness, or weakness. If you do, please let me know. And I've already assessed my patient's lung sounds, and I'm going to want to monitor his vital signs, especially his blood pressure. And I would also want to caution him against doing any potentially hazardous activity. I would let him know to avoid alcohol, as well as if he experiences any dry mouth, he can chew sugarless gum to help alleviate that. Okay, so once I've done that, I'm going to landmark for the appropriate injection site. So for this injection, I've chosen the ventrogluteal injection site, so I would ask the patient to lie on their side, and I would take my hand, I would place the palm of my hand on the greater trochanter of the patient's femur. I would have my thumb pointing towards their groin, my index finger pointing towards the iliac spine, my middle finger pointing towards the iliac crest, and I would inject into the space between my middle finger and my index finger. So once I've landmarked, I would apply my gloves. I would wash my hands and put my gloves on. Okay. And then I'm going to clean the injection site that I have already landmarked. So I would take my alcohol swab, I would clean in a 5 centimeter radius from the injection site for 30 seconds. So it's been 30 seconds, and then I would let that dry. And then for this injection, I will be Z-tracking, which involves displacing the subcutaneous tissue so that the medication goes into the muscle and does not leak out. So I'll be placing my hand onto the patient's body, and I will be pressing down and then displacing the tissue by moving my hand to the side. So I'm going to do that, but in some facilities I would aspirate, which involves pulling back on the plunger of the syringe, and if I did see blood come into the syringe, I would remove my needle and I would try again because I was not actually in the muscle. But this facility does not require that, so we will not be doing it. Okay, so now that the injection site is dry after I've cleaned it, I'm going to begin. So I'm going to be injecting at a 90-degree angle, as this is an intramuscular injection. Okay, so I will remove the cap of my needle. I'm going to Z-track. I'm going to go at a 90-degree angle, and I'm going to dart in. I'm going to stabilize, and I'm going to slowly inject the medication. Okay, and then I'm going to hold it for a couple seconds. I'll remove my stabilization, remove the needle, and remove my hand, and then I would be activating the safety mechanism on the needle, but for demonstration purposes, I will just recap using the scoop method here. Okay, and then I'm going to put my my needle into the sharps container. Okay, so once I've done that, I would have already applied my cotton ball to the injection site. I'm going to remove my gloves, wash my hands, and then I'm going to sign my MAR. Okay, and then once I'd done that, I would just explain to the patient that I would come back to check up on him in the next little while to make sure that his nausea and vomiting symptoms had been alleviated, because this was the purpose of the medication. And I would also come back to monitor his vital signs, more specifically his blood pressure. And then once I'd done that, I'm going to exit the room, and as I'm doing this, I'm doing my exit safety check, just making sure the patient is in a comfortable position. The bed is in the lowest position, the call bell is within reach, and the patient wasn't in any distress. And then I could exit the room, and I would document any of the nursing assessments I had done, such as his blood pressure.